My topic is, as has been mentioned, looking at labeling regulations on harmonized nutrient reference values. I think Lindsay's presentation lays clearly the foundation for the presentation I am about to make. In terms of disclosures, I am a member of the Micronutrient Forum. I'm a board member of the Micronutrient Forum. I joined about a month ago. Now, in terms of this topic, my interest in this topic goes far back when I was a member of the Ghana delegation to the Codex Committee on Nutrition for Special Dietary Uses, where nutrient reference values are actively discussed. Also, when I served as Director of Nutrition at FAO, we worked very closely with WHO in looking at nutrient reference values. To go on next, why are nutrient reference values now coming in so strongly? I'd like to establish a little bit of a background. An analysis that has been done by various groups shows that dietary risk factors have become a major cause or contributor to the burden of disease. And this is seen in various parts of the world. Globally, we see that malnutrition in all its forms is the leading contributor to the burden of disease. In high burden countries, you see a similar pattern. In low income countries, you see a similar pattern, where our dietary risk factors are creating problems. And in fact, an analysis that was done shows that poor diet actually contributes about 20% of premature deaths. Now, the problem about poor diet is seen in the rising prevalence of overweight and obesity. You can see the negative impacts of the way we are eating here, that no region is actually being able to reduce the prevalence of overweight and obesity. And even in low-income countries, overweight and obesity prevalences are rising very fast. So in the last 3 to 4 years, many groups and organizations have come out requesting that we actually look at our food systems, transform our food systems to ensure that they deliver on healthy diets. The Global Panel for Agriculture and Food Systems, the high-level panel of experts of the Committee on World Food Security, the Future of Food, various groups have come out. But an important aspect of this food systems transformation is the consumer. There's the call to actually empower the consumer so that they can make healthy dietary choices. And this can be achieved through mandated nutrition labeling. Very, very important. After all, the consumer buys the food, and if they are empowered, they can buy the right food with that information, the right information that they are given. So this then brings us to a topic of food labeling and its importance for the consumer. It provides the consumer with information about the product to be able to make that informed decision. It also provides information on the nutrients on the package. Really, this is so crucial. They have to know what is in the package. It also builds consumer confidence in packaged foods. We all go to the shop, we look at the label, and we are able to decide whether to buy this product or not. It also protects the consumer health and prevents fraud from false and misleading nutrition claims. Misleading nutrition claims happens in almost every country. Now, to show this example about how important food labeling is and how it can actually help the consumer make a decision, I would like to just present the example of the Chile experience. Chile has been experiencing rising prevalence of overweight and obesity, especially in children. The figures were really high. In 2016, they enacted a law on food labeling where and advertising to be able to curb this epidemic. So they came up with these labels, these black octagonal labels. So they use these labels because they are easy to understand. It's the front of pack labeling. And with this labeling, if you have this label on a product, that means that that product cannot be advertised to children under 14 years? Or could you include a toy in that product? Also, food containing that product cannot be sold in or near schools. So the intention is not that these products cannot be manufactured, but rather it will help change the food environment by informing the consumers about the composition of the product, the fat, the sodium, the calories, and the sugar. And the labels are so clear that when the consumer sees it, they would be able to understand it. It's so simple, very simple, easy to recognize, and to be understood that the consumer can easily make a decision for themselves. Now, for such labeling policies to work, it will require the collaboration of all stakeholders. It will require the governments coming out to enact these laws and regulations. It will require the food industry to comply and work with government so that they comply to these regulations. It will require the scientists to provide the evidence for making these policies. And also it will require the consumer corporation to make healthy and informed food choices. So all these stakeholders must come on board. Now let's talk about, Lizzie has given us a background about harmonized nutrient reference values, but we also need to talk about harmonizing food labeling regulations, because if you have harmonized regulations, it can avoid confusion for the consumer, because they will have to deal with different market labels, which can be confusing. But if it's harmonized, it makes it easy. It gives better understanding for consumer and industry, because they will all be following the same rules. It also makes it easier for codecs to elaborate and update a single food labeling standard. And also it fosters a regional harmonization of labeling policies, because now with globalized trade, it makes it very easy. Finally, it's also easier and less costly for food industry to comply with these labeling rules. This document you have here is a report, a book that was published by FAO in 2016, and it gives really background on some of these labeling policies, that how countries can really have some of these harmonized labeling policies. But an important thing in some of these labeling, some of the labels are mandatory and some are voluntary. In my presentation here, I'll be talking mainly about the mandatory policies. And these mandatory rules require that all food products carry the same information, okay? And also the labeling legislation will apply to all foods, whether imported or nationally produced. They should have common information, okay? Now, in a mandatory food product, what's the kind of information you would need are the identity of the food, the name, the amount, the contact information, the information on the manufacturer, the country of origin, and the lot number. You also need information on the ingredient list, what really went into that product. And I've highlighted the quantitative nutrient declaration, because that is really relevant to our presentation here, and I'll come to that in a few minutes. And then also the food additives that have been added, and then also the date marking. Date marking is very important because it helps the consumer to determine and expect in terms of the safety and the quality of the food. Now let's talk about the nutrient declaration that we will see on a label. So the quantitative nutrient declaration. Codex recommends mandatory declaration of nutrient content on the label. And here, what should be declared are the energy, the protein, available carbohydrates, total fat, saturated fat, sodium, and total sugars, and also some vitamins and minerals. Now, the way this is declared is very important. Some were declared as nutrient per serving, or per 100 grams, or per 100 ml, depending on the nature of the product. Now, with this, in terms of the mandatory nutritional information, some also look at reporting it as a percentage of the nutrient reference values. Now, Lindsay has already laid down the basis for the nutrient reference value, so I'll not go into that. But when you express the value as a percentage of nutrient reference value, it provides an overview of the nutrient level in the food. It also enables the consumer to compare the percent nutrient reference values of different packaged foods, and so be able to decide which food to choose because of the percent contribution. Now, Codex proposed nutrient reference values for nutrition labeling purposes in the interest of harmonization. And these were put forth by FAO and WHO in 2004. Now, this table shows the Codex proposed reference values. Now, as I said, these are from 2004. And at the moment, FAO and WHO are looking at revising some of these nutrient reference values. The process that they go through, it's here, and Lizzie took us through in details on these processes. She gave it in her presentation, so I will not spend too much time on these slides. But the important thing that I want to highlight is that there is also public consultation. So where you see PC means public consultation. So at some point, the document or the questions that need to be addressed needs to be put out for public consultation to collect public views on it. So this is done also as part of the process. Now, Codex has also two types of nutrient reference values. They have nutrient reference values requirement, and this is based more on, it refers to nutrient reference values that are based on the levels of nutrients associated with nutrient requirement. And this is really what Lindsay has presented on. Then there is also the nutrient reference values based on non-communicable diseases. And these are based on the levels of nutrients associated with the reduction in the risk of non-communicable diseases. So Codex has established NRV NCDs for saturated fatty acids. Here, about 20 grams for saturated fatty acids, and for sodium, 2,000 milligrams. That means that you will be choosing NRV NCDs that have lower or up to these values, because lower or up to these values, they will be associated with reduced risk. So these are the two categories of NRVs that Codex has established. Now, talking about harmonized nutrient reference values for global use. With international trade, harmonized nutrient reference values provide a uniform basis to compare nutrient contributions of similar products. So here I'm talking about the values themselves being harmonized so that countries will use harmonized values. And there is value in this because you can compare the nutrient contribution of similar products. Now, when consumer goes on the market, the consumer is bombarded with so many products of the same product. You have so many versions, and this will really help the consumer a lot. Harmonized NRVs will also provide the same denominator, because you're talking about the same denominator for assessing nutrient claims. Harmonized nutrient reference values will also facilitate monitoring and enforcement of labeling policies. And countries will be able to meet the labeling policies of the international market. We can set common labeling policies, and then we have harmonized nutrient reference values so that it makes it very easy to actually set common policies for markets and for countries to be able to trade among themselves, because we are actually harmonizing the process. So again, basically, as has been said, I would say that food labeling policy, which includes a set of laws and guidelines for establishing this information, and these provide the basis for what needs to be done. Now, consumers may be confused when you have different forms of labeling on food products. Simple, standardized, non-misleading labeling is needed to facilitate consumer understanding. And then Harmonized food labels are desirable based on what I've said earlier on, because it helps the consumer. And then finally, to come to the harmonized nutrient reference values are also needed because they provide a common basis for comparing similar packaged products. They can facilitate trade between regions and countries when we use the same values than when every country has its own values, and that can create problems for the consumer. On this note, I'd like to say a big thank you for this opportunity.